Okay, today we're going to talk about the drug delivery system, and we'll discuss regarding drug delivery system, the conventional drug delivery system, the novel drug delivery system, and in the novel drug delivery system, we'll be talking about the GIT DDS. And in this, yeah, DDS means drug delivery system. And in this, we'll be talking about the oral osmotic drug delivery system, ion exchange drug delivery system, pH activated drug delivery system, and biomucoadhesive drug delivery system. Fifth, the last one will be about the floating DDS. Okay, so let's start our discussion from the very first point, and that is the conventional drug delivery system. Now, what is conventional drug delivery system? Simple. The drug delivery system that is actually since the history, the prehistoric era, means since the beginning, the drug delivery system that is in use until now. But sometimes what we need no side effects or decrease in the side effects, so we cannot get that side effects being decreased by the conventional drug delivery system. Now, actually, conventional means that those kind of drugs that are actually coming since the very beginning until now we are using, because of which we see oftentimes multiple side effects. We see the wastage, we see the compliance, and we see the expenses and etc. with this novel, with this conventional drug delivery system. So, in short, we are actually fed up of actually a conventional drug delivery system. Now we want such kind of drugs which will have very less side effects and which will actually decrease the wastage, and along with that they will increase the patient compliance. Suppose a patient is there who is supposed to take a medicine 4 times a day or 3 times a day, means TDS or etc. So what will we do? A patient will ask us, please give us the medicine that was supposed to be taken just one time a day or OD. So in that case, if we don't have that drug, so the patient might not be able to use the entire prescription or the entire medication in a sequence. So you can say in short, one can say in short, the patient will be a kind non-compliant towards the therapy. So what will we do now? What we are doing now and what the researchers are actually doing now, they are actually switching towards the novel drug delivery system, means the new type of the drug delivery system, in which if we follow this new type of drug delivery system, what will happen? We'll have reduced side effects, we'll have decreased in the wastage of drug, we'll have increased compliance of the patients, and etc. So what's happening in both the cases, whether it is novel and conventional? First of all, the basic theme is the drug will go towards the receptor and then it will show its action. Drug will move towards receptor and that will show its action. Now, what is happening in the conventional drug delivery system? The drug is moving towards the receptor, but sometimes it starts showing action somewhere else also during the pathway when it is moving towards the receptor. So what we do now, in order to one can say in order to stop make obstacles for the drug, we just take a kind of thing, a kind of vector, a kind of path. We just select a kind of strategy by means of which our drug will straightforward move towards the receptor and it will show its action on the receptor and will get the desired effect. Like this, the side effects will be subsided, one can say, means one can say that the side effects will be reduced. So what we do now, we take some kind of particles. By means of these particles, this novel drug delivery system is actually becoming, one can say, helpful. In sense of what? In sense of all these points. By means of this novel drug delivery system, our side effects are reduced, our wastage of the drugs are reduced, our compliance gets increased, and etc. So now what we do and how this novel drug delivery system is functional. How this is specific for the specific receptor. We can say how these points are actually achieved. Very simple. In the novel drug delivery system, we are actually taking the help from the nanoparticles. Nanoparticles. These nanoparticles are actually of two types, nanospheres and nanocapsules. By means of these particles, we are actually able to deliver a drug to the specific receptor. And like this, what is happening? All these points are actually achieved with some more points, some more benefits. So now how this drug is moving specifically straight forward to the receptor, instead it is not going somewhere else, means it is not showing some kind of worse side effects. So what is it doing? Very simple. Nanoparticles are actually the particles. In these particles we place the drug. What we do, we take this particle, then we place the drugs inside this particle. Then this particle is actually made like on which there are then ligands attached. Now these ligands Remember, this drug is a ligand, okay? Now this ligand or this drug will move straight to the specific receptor. Now these ligands are made in a sense that this is very specific for a specific receptor. This ligand will not bind anywhere else. It will only bind on this receptor. I need the drug which will go toward this receptor, and it must not go anywhere else. So for that I will do what? I will take this drug. With this drug I will attach, with this drug I will first of all do some kind of this mechanism. I will take the drug and I will take it into the nanoparticle. Then on the nanoparticle I will have some specific ligands. Those ligands, with those ligands, now with all this kind of setup, if I take this kind of drug, this kind of tablet, this kind of medicine, if I indicate this kind of medicine to the patient, that will specifically move towards the specific receptor. Like this, what I got? I got the reduced side effects. Before, our drug was supposed to have some sort of actions when it was going through the entire pathway. Now it will not have actions. Why? Because I have made it specific. I have made it specific by means of this mechanism. Drug is actually covered in the nanoparticle. Then the nanoparticles are actually made to have such kind of ligands. Those ligands are actually supposed to act on specific receptors then. So this is how my drug is becoming specific and I'm getting reduced in side effects. Got? So this is very important point. Second vestige, regarding vestige, I will tell you people there at the end of the lecture. And now coming towards the compliance. Now, because of this novel drug delivery system, compliance is actually increased. Means before a patient was actually asking that I am not able to take medicine 4 times a day because I have some kind of busy schedules, or there is a kind of patient who that is having a kind of memory problem. So because of which again the patient says that I missed this therapy. Now what to do? So means there are actually complications with this one conventional drug delivery system. Now in order to reduce those complications, what we do, we are actually shifting towards the novel drug delivery system. Now by means of this, what we are getting is we are getting the controlled release fashion drugs and extended release fashion drugs. Now what these drugs are actually helping us in a sense, simple. Controlled release will do what? Before, if a patient was supposed to take one medicine 5 times a day, 4 times a day, 3 times a day, whatsoever was the time or interval or frequency of the drug of the patient. Now that patient will be shifting towards only one time. Suppose we are giving the patient a chip, any patch. So if you take the patch on the skin, what will happen? The patch will, with a controlled fashion, will release the drug into the body, or we will indicate the patient the oral osmotic drug, or the ion exchange drug, or etc. So what we are going to discuss in a moment later, we'll discuss all about that. Well, in short, a patient is there that is actually now supposed to be having just compliance increased. Means now, from now onwards, our patients will be a kind stable. Why? Because that patient will be receiving such kind of medicines which will be actually used one time a day. Example, suppose, okay? So now like this, what will happen? Compliance will increase. Why? Because that person will just take that drug only one time a day, and then the entire day that person will be free. So now how this is doing? Very simple. By means of this part, this mechanism and some other mechanisms, this compliance will be achieved. Now why this is achieved, how this is achieved? Simple. There will be sustained release, controlled release and extended release. For a longer period of time, the drug will be in the body and it will be releasing its content slowly and gradually. Now this release will be in two fashions. This slow and gradual release of the medicine will be in two fashions. Number one, controlled. Number two, extended. By sustained, we mean the drug that is actually having releasing ability with the passage of time. Means for a long period of time, it is releasing its content slowly and gradually. Means the drug is released slowly and gradually for a longer period of time. But in this sustained, we have further two fashions. Number one is controlled, number two is extended. Controlled is such kind of sustained release in which there is actually controlled fashion. Suppose if I'm giving a patient a drug, I know that I'm controlling this drug in his body. I will give such kind of drug which will actually release its content in a controlled fashion. Means it is predetermined. We know this, that if I give drug A to the patient, drug A will be releasing its content in the body for about 8 hours. And this will be releasing, suppose, 2 particles at a time. I know the amount, I know the frequency, you can say the time the manner that is the method that it is actually releasing the content. So if I know and it is in our control, that is called as controlled release drug delivery system, and this is actually a sustained release. For a longer period of time, we say that if a drug is releasing its content for longer period of time, it is sustained release. And if this is releasing for longer period of time in a controlled fashion, this is controlled release. And if there is no control, this is extended release. Got? If it is controlled, that is controlled release. If this release is not controlled, then this is called as extended release. I hope you got the understandings. If still you have confusion, ask us in the comment box. We'll give you some more examples and we'll make another video for this. Okay? Ask us in the comment box. Well, now let's come towards the next point, that is actually the GIT drug delivery system, novel GIT drug delivery system. Before we were having conventional drug delivery system in which we were having the vestige of the drug. So by means of this method, we're not having any more vestige of the drug. Okay, how? Like, very simple. You will get this answer while I'm explaining 1, 2, 3, 4, 5 types of the novel GIT drug delivery system. The very first of the 5 is oral osmotic drug delivery system. In this, we are using some pumps, oral osmotic pumps. Now, if we take that pump, that actually the tablet is actually a pump, okay? That is actually taken. That will move into the body. Inside the body, as it reaches, it will start releasing. It will start functioning by means of osmosis. Now, in this, you can guess the oral osmotic by means of oral means the medicine that you're taking through oral route. Okay, osmotic is actually such medicine that is functional under the principle of the osmosis. So this drug will release its content by means of osmosis. I am having a drug. Now, what is osmosis? Osmosis is actually the movement of particles through the semi-permeable membrane, and that is actually from the higher to the lower concentration. Well, you guys know about the osmosis from the beginning, since the 9th, 10th grades. Okay, well, what is happening here? This is actually the step, or you can say the pathway by means of which the oral osmotic drug delivery system is releasing its drug into the body. So we take these drugs, these are called as osmotic pumps. Okay, there are several types of osmotic pumps which are releasing the medicine into the body by means of this pathway. How? Like, very simple. Here is our drug. What will happen is it is entered in the body. So it is actually having the semi-permeable membrane, and we know osmosis is happening through this semi-permeable membrane. So what will happen? The water or the fluid present in the body will start moving inside this. As it enters inside the body of the tablet, body of this semi-permeable membrane, as this fluid gets entry into the body of semi-permeable membrane, what will happen? We know that this fluid will start exerting pressure on the wall of the semi-permeable membrane. We call that as osmotic pressure. So as the osmotic pressure is increased, what will happen? Then that semi-permeability will be increased to a kind more permeability. What will happen then? Then a kind pores will be created. So from those pores, then whatever the drug was present in this semi-permeable membrane, that will start coming out. So like this, with a slow, in a slow fashion, with the passage of time, the drug will be released, whether it is controlled or extended. That is depending upon the drug. Whether the drug I am indicating to the patient, whether it is controlled one or extended one. So both, whatsoever the cases, by means of this method, we can have a sustained release of the drug. We can have a sustained release of the drug, in short, in a nutshell. Okay, that's it. I hope you got the understandings. Simple. Oral osmotic drug delivery system is actually functional by means of the principle that is osmosis. Now, what is osmosis? Through a semi-permeable membrane, when there is actually the diffusion of the particles or of something. So what happens now? The drug that I have taken, that is actually in the semi-permeable membrane, as I gave this drug will reach the body, and the fluid surrounding this drug, that will allow, it is actually semi-permeable. So the water in the body, that in that fluid, will start moving inside this semi-permeable membrane, and that will then exert osmotic pressure, which will increase the pore size. So due to which, then what will happen? Then the drug will start dissolving, and with the passage of time, it will start releasing the drug content into the body, and then that drug will show its action. I hope you got the understandings. Now let's come towards the ion exchange drug delivery system. Now what is happening here? Very simple. We take a drug and we take a resin. Now this resin has some sort of ions, whether it is positive or negative. So if it is positive, we call it as cationic resin. If it is negative, we call it as anionic resin. Okay. Now if you guys are feeling confusion how to memorize this cationic and anionic, for that I'm telling you guys a trick. Here is the trick. Suppose if a resin is having a cation, that is actually called as cationic resin. So remember, cation like cationic resin. So in short, cationic resin is actually resin having positive charge. Anionic resin is the resin having negative charge. I hope you got the trick. If you have got, kindly mention in the comment box. Well, what is happening in ion exchange drug delivery system? In the entire pathway, in the entire mechanism, what will happen? You will observe the exchange of ions. Exchange of ions. So that's why this mechanism is given the name is ion exchange resin. Now, how this is happening, let me tell you in this portion of the lecture. We'll take the drug, we'll paste the drug on the resin. Then over that we'll be having polyethylene glycol, which is actually a polymer. So now we have resonates having the polymer. This will go into the body. What will happen? It is depending upon the resin. If resin is positive, there will be the cationic exchange. If the resin is negative, there will be anionic exchange. So now, how the drug will be released? The question is that simple. We took the polymer, we took the fixed functional group resin. Okay, now here consider that we're having a resin and a drug. So here is the polymer and the negatively charged resin, and here we have the positively charged drug attached to it. Now don't confuse yourselves with the cationic exchange and anionic exchange. Simple, observe this mechanism happening here. Whatever the drug is doing, that will be giving you guys the concept of the cationic exchange and anionic exchange. And further regarding the resins, you guys must remember we have cationic resins and anionic resins. Now what change of the is happening, what changes, what sort of ions are actually being exchanged with the drug, that is actually the particular cationic exchange or anionic exchange. Simple, that is the particular exchange. Simple. Okay, don't make yourself confused. Like, well, what is happening here? A polymer having a fixed ion, it may be negative or positive. Now in our this topic, we are considering this polymer being attached with a negatively charged ion. With a negatively charged ion, and with that we have a drug attached, which is actually, suppose in our this case, a positively charged ion drug. Now this is called as cationic drug. Suppose in our this mechanism, it is actually a kind of example I'm giving you guys. This is actually a tablet having a cation, a positive ion. So now this will actually undergo the cationic exchange. This will undergo the cationic exchange. Now how this exchange is taking place? Simple. As I take this cationic drug, this will go to our GIT. There the fluid of the GIT having the positive charge, that fluid will start exchanging the ions. Now that fluid must be positive. If our drug is positive, the fluid must be positive. Okay, this is the very point to be remembered. What will happen now? Now with the passage of time, this positive will be exchanging with the positive of the drug, and like this the drug will start releasing actually its content into the body. So this is how, by means of an exchange, there is the release of the drug. Drug ion exchange, drug released. Mechanism happening hereby. What is happening hereby? Very simple. A drug is actually in ion form, and here we have the ions in the fluid of the GIT. So now if our drug is in the positive ion form, and our fluids are actually again having positive and negative also. So positive of the fluid, negative will be taken aside. Okay, negative will not interact here. The positive will come, and that will displace, exchange the positive of the drug. So like this the drug will start releasing its content into the body. Okay, same kind of charges will do the exchange. Okay, same kind of charges. You can say, for the sake of concept, you can say that this fluid, the positive ion of the fluid is a kind competitive with this positive ion of the drug. So this will come and this will displace this positive from the fixed polymer of the fixed ion of the polymer. So like this what will happen, the drug will be released, and then the released drug will start showing its action. The released drug will move towards the receptor, and then it will bind to the receptor, then it will show the action. So now what is happening here? Exchange of the ions, due to which this DDS, this drug delivery system, is now as ion exchange drug delivery system. Next we have pH activated drug delivery system. Now what we get here is pH activated, such kind of drug delivery system which is actually helping us to release a drug, to take a drug, and that drug is actually releasing its content in a certain pH. In short, desired pH drug release is actually obtained by means of pH activated drug delivery system. Now you guys will get this by means of an example. Suppose I have a drug, and that drug is actually acetylamide. If I take it, it comes to the gastric region, and the acid of the stomach will destroy this drug. Now what I will do, and what I want, first of all, I want this drug not to be destroyed by the acid of the stomach. It must go into the alkaline medium of the intestine, and it must show its action in the alkaline medium. So now if my drug is being destroyed by the acid of the gastric region, so what will I do now? I will take such kind of strategy by means of which I will protect my drug from the acidic medium, and then as this drug reaches the intestine, there it will show its action then. So now how I will get this? I will get this by means of pH activated drug delivery system. Now how this is functioning? Very simple. I will take my drug in the core, in the center, or now first of all I will just cover this drug with the porous covering, okay, porous covering. Then after that I will have HPMC or ethyl cellulose. HPMC stands for hydroxypropyl methyl cellulose. I will take two coverings with the drug. First covering is actually porous, second covering or encapsulation is of the hydroxypropyl methyl cellulose or ethyl cellulose. Now what this is doing, I will take this drug now. Now this is our drug actually prepared. Now if I take this drug and indicate to the patient, what will happen? Stomach acid will not do any kind of interaction with the drug. Why? Because hydroxypropyl methyl cellulose, ethyl cellulose, hydroxypropyl methyl cellulose and ethyl cellulose, these two are actually a kind resistant to the acid of the stomach. So what will happen? Then this drug will reach safely to the intestine. Now as it reaches in the intestine, this HPMC or ethyl cellulose encapsulation is then dissolved in the alkaline medium on its own. You can say the first layer is actually then lost. The remaining second layer is actually the porous but insoluble layer. Porous but insoluble. Now this is insoluble in the intestinal region. So what will happen? The drug is still inside the porous membrane. So what will happen now? Simple. The fluid will start moving into this, but through this porous membrane, and then this drug will be dissolved. And with the passage of time, through these pores, by means of pore channel diffusion, the drug will start releasing its content into the surrounding. Simple and easy. So this is how pH activated drug delivery system is actually helping us to take a medicine. Before this medicine was not able to be indicated orally. Now I can indicate this medicine orally because I got a technique. This technique is actually given the name novel technique, and this is actually called as pH activated drug delivery system technique. Okay, simple. Then we have biomucoadhesive drug delivery system. You can get the entire concept from the name. Bio, living organisms. Mucus. Wherever you see the mucus, here, anywhere in the body where there is orifice and there is mucus, you can take this drug. What will this drug do? This will actually adhere to the mucous membrane. Okay, I took the drug. This drug will go to the mucous membrane. This will interact with the mucous membrane by means of what? By means of covalent bond, hydrogen bonding, and van der Waals forces, etc., etc. So it will actually have its interaction with the mucous membrane, and then as it interacts, it will stick there, and gradually, slowly and gradually, it will start releasing its content. And if the drug is releasing, and it is obvious, the drug will go towards the receptor and it will show its action over there. Then we have the fifth one, floating drug delivery system. Now sometimes in conventional drug delivery system, it was a kind of point for us that two things were here regarding those medications. Suppose I was supposed to take a medicine which was supposed to show its action in the gastric region, and which was supposed to show in the body, in the gastric region, for a longer period of time. But what was happening, that medicine was very quickly, you can say, was moving out through the GIT tract, and it was creating problems. Like, number one, it was increasing the wastage of the drug. Number two, it was increasing the, you can say, it was decreasing the patient compliance. A patient was not then happy to take medicine time and again. Why? Because there are several conditions that make a patient non-compliant to the medicine, to the therapy. So what we did, we get the floating drug delivery system. Now by means of floating drug delivery system, we'll get two benefits, many benefits, but here regarding that I have actually written on the board, these benefits. from all these two benefits are actually achieved. By the way, all the benefits are achieved, but the remaining are actually the vesting and compliance. I'm actually making you guys understand regarding this last point with these 2 points. How the novel drug delivery system is actually helping us to decrease the wastage of the time, wastage of the drug or medicine, and along with that, it is increasing the compliance of the patient. Very simple. Now, this is how floating drug delivery system will help us. We'll take the drug. That drug will become a kind, will be made in a such sense that that drug will be having a density very low. We know this point very well. We will take a medicine or anything, and if you observe the water, simply coming towards the water, if you take anything having density much higher than the water, what will happen then? That thing will start moving inside the water, will dip inside the water. But if we take something like a wood, paper, or something like ice, it starts floating on the water. Now, what is the reason? The reason is that that thing is actually having less density. So now what we are doing, we will go through the novel techniques by means of which we'll make such medicine that will then float on the GIT fluid. And then, as if it is floating, so the case is obvious. Its retention time will increase. Now, what we are getting through this floating drug delivery system is we are actually changing the density in a sense that our particular drug will start floating on the GIT fluid. So if it starts floating, what will happen then? It will not be moving through the GIT. It will be available on the GIT fluid. And as if it is available, with the passage of time, this floating drug will actually start releasing its content, and then the action will be actually observed. So like this, what is happening? Before, our drug was in conventional drug delivery system, our drug was moving through the GIT very quickly. Now it is not moving quickly because it is floating on the GIT fluid. And second, in conventional, we were having the wastage of the drug. Now that drug will not be more. Okay, so the wastage is actually a kind reduced. And then we had another problem was of the compliance. From now onwards, our patients will not be having non-compliance. Why? Because the patient will take their medicine, and that will show its actions. And then we had expenses. So again, expenses, etc., etc., etc. In short, by means of all these mechanisms, we got all the benefits from by means of a novel drug delivery system, which were actually the drawbacks of the conventional drug delivery system. In the conventional drug delivery system, we were having so many drawbacks, and by means of novel drug delivery system, we got actually a kind covered all those portions, and now we're actually moving towards the safe therapy. So that's how the novel drug delivery system is actually functional and helping us. I hope you got the understandings. And regarding this side of the picture of the board, if you guys are actually having or facing problem over this side, I will share the picture of the entire board, so you will get the details in that pictures, in those pictures in a very simple and easy way. So, well, if still you have confusion anywhere in the topic, feel free to ask us in the comment box, and thank you for watching.